We're going to have less providers. Your studies have revealed maybe 40 to 50%, for example, in the state of Iowa. What is this going to mean?
Well, it's going to mean that there are going to be access problems for users of home medical equipment. I've created maps that look at where the providers are and which ones I think are likely to close. And that leaves big holes in the state of areas that don't have providers nearby. And so it's going to create some access problems.
Mike, you're a small town guy.
Well, I grew up in small town Iowa. I think I understand small town Iowa. I understand the values, and I understand the lifestyle. And the federal bureaucrats that are making these decisions, unfortunately, they don't understand small town Iowa. To them, it doesn't matter if a small community like a Charles City loses a medical provider. They don't understand the importance of local medical care in our small towns. So our smaller towns that are vibrant, viable communities, that places like Owine and Charles City and Storm Lake and Clarinda, those size communities, these are the communities that are going to be severely affected by this bidding scheme, this low bid scheme. Those are communities that are going to lose their home medical equipment providers, and they're going to have to access their care and their equipment and the support and service from far away. And let's face it, our small communities in Iowa are full of an aging population. And if anything, those communities and across Iowa, we need more home care and medical infrastructure in our small towns, not less. We have an aging of Iowa. We need more support. We need more capabilities. And this federal policy that's being forced upon us is actually going to work the opposite and pull those resources, those jobs, that access, those local businesses out of our small communities and put them in faraway cities where things can be drop shipped to little old ladies who don't know how to handle that complex medical equipment.
If you take this one step farther, this could conceivably lead to more medical costs because of delayed hospital discharge times. Is that does that make sense?
Well, it's common sense that this will lead to higher medical costs. What some of our bureaucrats in Washington apparently don't understand is a couple things about medical care and about lifestyle. Overwhelmingly, people would prefer to be at home. If people are given a choice of being in a hospital, a rehab facility, a nursing home, or in their own home, overwhelmingly they choose their own home.
Of course.
That is where the best care is. That is where they've got the highest quality of life. And that's where they want to be. And apparently not everybody in Washington realizes that 40% of the seniors are already suffering from some kind of disability. Over a third of seniors live at home alone. So this is a segment of society that is in a difficult situation oftentimes, and they need assistive devices. They need medical equipment to make life easier. They need medical equipment to make it safer and to be able to stay at home versus being institutionalized. It's a much lower cost way of doing things. It's far lower, as you cited at the opening of the program, far lower cost to be at home, to take care of somebody at home, than it is in an institutional setting. And by pulling the infrastructure out of home care across our state and across our nation, we're going to increase the cost of health care significantly, but more importantly, we're going to decrease the quality of life of people with disabilities and frail seniors.
And I just want to shed some light on that too when we're talking about having local providers. I actually visited with a respiratory patient. He's 73 years old, and one of his biggest concerns when I met with him was not having his local provider available to him and having to rely on a national chain or a Walmart of some sort to take care of him, and he did not feel comfortable with that.
I think that something we in the Midwest are certainly cognizant of is weather-related power outages. one of the people that we have spoken with, and his name is Larry, talks about what it's like to have the tanks delivered and know that you have a backup. So let's let Larry talk to us in his own words.
Larry, Congress has passed some legislation that is eliminating many home care providers across the country. Is there anything you would like to tell them about that?
Don't eliminate them. They're a lot of people's life, and it's sure going to be miserable for a lot of us.
What kind of burden would it put on your family if they were telling you that all the local community DME dealers were going to be diminished because of the legislation that was going on? How would that affect you?
That would affect me greatly. I mean, what could I do? If I had, even if they give me 10 tanks and I had 5 of them today and 5 of them tomorrow, I'll tell them I need 5 right away. You wouldn't get them right away. And you needed 5 the next day, you used them up. Where would you be at? You'd be sitting in the house. And if your machine went down, what? Now I can get it immediately, they'll bring another one. That won't happen with a big outfit.